Question 1. A patient receiving digoxin for heart failure reports nausea, visual disturbances, and fatigue. Vital signs show HR 52 beats per minute and blood pressure 116/76 millimeters of mercury. What is the most appropriate nursing action? A. Administer the scheduled dose with food. B. Notify the provider and hold the medication. C. Encourage fluid intake and reassess in 1 hour. D. Check blood pressure again before deciding. Answer. B. Notify the provider and hold the medication. Rationale. The constellation of symptoms along with bradycardia indicates potential digoxin toxicity. The priority is to hold the medication and notify the provider for evaluation and serum level monitoring. Administering the dose or delaying action risks worsening toxicity. Question 2. A patient on warfarin has an international normalized ratio of 5.2 and reports spontaneous nosebleeds. Which action should the nurse take first? A. Educate the patient to avoid high vitamin K foods. B. Notify the provider and prepare to administer vitamin K. C. Document the finding and reassess in 4 hours. D. Encourage the patient to lie down and apply pressure. Answer. B. Notify the provider and prepare to administer vitamin K. Rationale. An international normalized ratio 5 with active bleeding is a medical emergency. The nurse must anticipate the need for reversal with vitamin K. Pressure or dietary education does not address the acute bleeding risk. Question 3. A patient receiving gentamicin for sepsis reports ringing in the ears and dizziness. Which action demonstrates the highest priority nursing response? A. Reassure the patient these symptoms are expected. B. Continue the infusion and monitor closely. C. Stop the infusion and assess cranial nerve 8. D. Offer supportive care until symptoms resolve. Answer. C. Stop the infusion and assess cranial nerve 8. Rationale. Ototoxicity is a severe, dose-related adverse effect of aminoglycosides. Stopping the drug and assessing hearing function is essential to prevent permanent damage. Reassurance delays critical intervention. Question 4. A patient taking lisinopril reports a dry, non-productive cough and mild facial swelling. What is the nurse's best next action? A. Instruct the patient to continue and monitor symptoms. B. Administer an antihistamine and observe response. C. Discontinue the medication and report symptoms urgently. D. Suggest switching to a loop diuretic. Answer. C. Discontinue the medication and report symptoms urgently. Rationale. Facial swelling suggests potential angioedema, a rare but life-threatening side effect of ACE inhibitors. Discontinuing and urgent reporting are critical. Antihistamines or waiting could delay life-saving interventions. Question 5. A patient receiving vancomycin via IV rapidly develops flushing of the face, pruritus, and hypotension. What should the nurse do first? A. Stop the infusion and assess airway and vitals. B. Slow the infusion rate and reassess in 15 minutes. C. Administer diphenhydramine and continue the infusion. D. Document findings and finish infusion over 30 minutes. Answer. A. Stop the infusion and assess airway and vitals. Rationale. These are signs of Redman syndrome or possible anaphylaxis. The priority is airway and cardiovascular assessment while stopping the drug. Slowing the infusion is appropriate only in mild cases without hypotension. Question 6. A patient receiving high-dose prednisone exhibits elevated glucose, 275 milligrams per deciliter, facial puffiness, and mood swings. Which action takes priority? A. Notify the provider to discontinue the corticosteroid. B. Assess blood glucose trends and anticipate sliding scale insulin. C. Reassure the patient these are temporary side effects. D. Encourage the patient to engage in physical activity. Answer. B. Assess blood glucose trends and anticipate sliding scale insulin. Rationale: corticosteroids commonly cause hyperglycemia. The nurse must monitor trends and prepare for insulin intervention. Discontinuing abruptly can cause adrenal crisis. Reassurance without data is inappropriate. Question 7. A patient using albuterol reports frequent use, 8 times per day, tremors, and palpitations. What is the nurse's priority intervention? A. Educate the patient about proper inhaler technique. B. Notify the provider about possible overuse and reassess treatment. C. Suggest caffeine restriction and observe response. D. Reassure that side effects are transient. Answer: B. Notify the provider about possible overuse and reassess treatment. Rationale: overuse of albuterol may indicate uncontrolled asthma and risk for beta-agonist toxicity. This requires reassessment of the patient's long-term management plan. Education is important, but not the priority in acute overuse. Question 8. A patient on metoprolol for hypertension reports lightheadedness when standing and a heart rate of 48 beats per minute. Which is the most appropriate nursing action? A. Withhold the next dose and notify the provider. B. Advise the patient to change position slowly. C. Encourage fluid intake to improve perfusion. D. Administer the dose and monitor closely. Answer: A. Withhold the next dose and notify the provider. Rationale: bradycardia and orthostatic symptoms are serious adverse effects of beta blockers. Holding the dose and notifying the provider prevents worsening hypotension or syncope. Encouraging fluids or continuing the dose risks harm. Question 9. A patient taking clozapine presents with low-grade fever, sore throat, and malaise. Which action should the nurse take first? A. Educate the patient to use lozenges and rest. B. Check the most recent white blood cell and neutrophil count. C. Continue the dose and monitor temperature. D. Suggest switching to a different antipsychotic. Answer: B. Check the most recent white blood cell and neutrophil count. Rationale: clozapine can cause agranulocytosis. Assessing lab data before acting ensures safe clinical judgment. Holding or switching meds without objective data is premature and could disrupt necessary treatment. Question 10. A patient on atorvastatin reports new onset of severe bilateral thigh pain and dark-colored urine. Which should the nurse do first? A. Encourage hydration and reassess in 2 hours. B. Notify the provider and hold the medication. C. Continue the drug and monitor creatine kinase. D. Recommend warm compresses for muscle relaxation. Answer: B. Notify the provider and hold the medication. Rationale: muscle pain and dark urine suggest rhabdomyolysis, a life-threatening adverse effect. Statins must be stopped and labs, CK, renal function, evaluated. Delaying action risks renal failure. Question 11. A patient on linezolid for a VRE infection becomes hypertensive and confused after eating aged cheese. Which nursing action is most urgent? A. Administer a beta blocker stat. B. Notify the provider and prepare to discontinue the antibiotic. C. Instruct the patient to avoid tyramine-rich foods. D. Document the event and reassess later. Answer: B. Notify the provider and prepare to discontinue the antibiotic. Rationale: the patient is likely experiencing a hypertensive crisis due to a food-drug interaction with linezolid, which has MAOI-like effects. This requires immediate provider notification and likely discontinuation. Education and documentation are not safe or timely enough. Question 12. A patient on isoniazid reports burning feet and difficulty walking. Which action shows the nurse's critical judgment? A. Reassure the patient that it's a common side effect. B. Immediately stop isoniazid therapy. C. Administer vitamin B6 as prescribed and notify the provider. D. Refer to neurology for nerve conduction testing. Answer: C. Administer vitamin B6 as prescribed and notify the provider. Rationale: peripheral neuropathy from isoniazid is preventable and treatable with vitamin B6. Early treatment prevents permanent damage. Stopping therapy delays TB treatment and isn't the first response. Question 13. A patient receiving intravenous phenytoin becomes hypotensive and bradycardic. The IV is infusing at 75 mg per minute. What is the immediate priority? A. Slow the rate to 25 mg per minute and continue. B. Elevate the head of the bed. C. Stop the infusion and call for rapid response. D. Prepare to give atropine. Answer: C. Stop the infusion and call for rapid response. Rationale: the safe rate of IV phenytoin is 50 mg per minute. Max cardiovascular collapse is a known complication of rapid infusion. Immediate discontinuation and emergency support are critical to prevent cardiac arrest. Question 14. A patient on high-dose fluoxetine becomes confused, diaphoretic, and has a temperature of 104 degrees Fahrenheit. What is the priority nursing action? A. Administer acetaminophen. B. Check blood glucose levels. C. Initiate cooling and notify the provider immediately. D. Apply oxygen and elevate the head of the bed. Answer: C. Initiate cooling and notify the provider immediately. Rationale: these are signs of serotonin syndrome, a life-threatening condition. High fever, altered mental status, and autonomic instability require urgent intervention. Supportive cooling and stopping serotonergic meds are crucial. Question 15. A post-op patient on enoxaparin suddenly complains of sharp chest pain and hemoptysis. What is the nurse's first action? A. Prepare for a stat chest X-ray. B. Auscultate lung sounds. C. Call the rapid response team immediately. D. Instruct the patient to use incentive spirometry. Answer: C. Call the rapid response team immediately. Rationale: the patient may be experiencing a pulmonary embolism, a life-threatening complication of surgery and immobility. Enoxaparin use does not eliminate risk. This situation requires emergency management, not further assessment alone. Question 16. A patient on carbamazepine presents with a fever of 102 degrees Fahrenheit, oral ulcers, and fatigue. What should the nurse do immediately? A. Administer antipyretics and encourage fluids. B. Contact the provider and request a CBC. C. Provide a soft diet and oral care. D. Ask about recent dietary intake. Answer: B. Contact the provider and request a CBC. Rationale: these symptoms suggest agranulocytosis, a known adverse effect of carbamazepine. Early lab assessment can confirm neutropenia and prevent sepsis. Symptom management without diagnostics delays care. Question 17. A patient on spironolactone reports palpitations and difficulty breathing. The ECG shows peak T waves. What is the immediate nursing action? A. Check the most recent sodium level. B. Notify the provider and prepare to administer calcium gluconate. C. Encourage fluid intake and reassess. D. Document the ECG findings and continue monitoring. Answer: B. Notify the provider and prepare to administer calcium gluconate. Rationale: peak T waves signal hyperkalemia, which can cause fatal arrhythmias. Spironolactone raises potassium levels. Calcium gluconate stabilizes cardiac membranes while further treatment is initiated. Question 18. A patient on clopidogrel post-stent reports black stools and lightheadedness. What action must the nurse take first? A. Place the patient on bed rest with IV fluids. B. Withhold the next dose and notify the provider immediately. C. Educate the patient about bleeding precautions. D. Recheck hemoglobin in the morning. Answer: B. Withhold the next dose and notify the provider immediately. Rationale. These signs indicate gastrointestinal bleeding. Continuing clopidogrel could worsen bleeding and delay treatment. Holding the drug and alerting the provider allows for evaluation and potential intervention. Question 19. A patient on lithium has tremors, ataxia, and slurred speech. Labs reveal a lithium level of 2.3 milliequivalent per liter. What is the priority intervention? A. Administer activated charcoal. B. Prepare for emergency dialysis. C. Recheck the lithium level in 2 hours. D. Hold lithium and start IV fluids. Answer. D. Hold lithium and start IV fluids. Rationale. A level greater than 2.0 milliequivalent per liter is toxic and needs aggressive hydration to promote excretion. While dialysis may be considered, initial action is IV fluid administration and withholding lithium. Question 20. A patient on levothyroxine for hypothyroidism reports chest pain, restlessness, and new-onset atrial fibrillation. What is the nurse's most critical action? A. Administer a beta blocker immediately. B. Notify the provider and withhold the next dose. C. Encourage rest and reduce environmental stimuli. D. Assess the TSH level before intervening. Answer. B. Notify the provider and withhold the next dose. Rationale. These symptoms suggest thyrotoxicosis due to overdosage. Withholding further levothyroxine and notifying the provider prevents worsening cardiovascular complications. Waiting for labs delays critical care. Question 21. A 32-year-old patient on clozapine for treatment-resistant schizophrenia presents to the clinic with low-grade fever, sore throat, and a WBC of 2,500 per cubic millimeters. What is the nurse's immediate clinical action? A. Document findings and advise follow-up in 24 hours. B. Continue medication and initiate infection precautions. C. Hold the next dose of clozapine and notify the provider. D. Administer antipyretic and encourage hydration. Answer. C. Hold the next dose of clozapine and notify the provider. Rationale. A WBC below 3,000 per cubic millimeters with infection signs suggests agranulocytosis, a life-threatening adverse effect of clozapine. Immediate drug cessation and provider notification are required to prevent sepsis. Question 22. A patient with type 2 diabetes taking metformin is scheduled for a contrast-enhanced CT scan. Serum creatinine is 2.1 milligrams per deciliter. Which action is most critical to prevent harm? A. Proceed with scan and monitor blood glucose post-procedure. B. Administer insulin as needed and continue metformin. C. Hold metformin 24 hours before and at least 48 hours after the scan. D. Encourage fluids and resume metformin once alert. Answer. C. Hold metformin 24 hours before and at least 48 hours after the scan. Rationale. Metformin must be held to avoid contrast-induced nephropathy and lactic acidosis, especially with elevated creatinine. Timing and renal function reassessment are key to safe reinitiation. Question 23. A patient receiving IV vancomycin for MRSA develops intense flushing, facial erythema, and hypotension 10 minutes into the infusion. What should the nurse do first? A. Stop the infusion and notify the provider. B. Slow the infusion rate and monitor symptoms. C. Administer diphenhydramine and resume infusion. D. Apply oxygen and initiate fluid resuscitation. Answer. B. Slow the infusion rate and monitor symptoms. Rationale. These symptoms are consistent with red man syndrome, not true anaphylaxis. Slowing the rate reduces histamine release. Stopping unnecessarily could delay therapy. Diphenhydramine may be ordered next. Question 24. An elderly heart failure patient reports seeing yellow halos and is nauseated. Vital signs show HR 50 beats per minute and blood pressure 96/60 millimeters of mercury. Which is the most appropriate first response? A. Administer the prescribed digoxin with caution. B. Hold digoxin and notify the healthcare provider. C. Increase fluid intake to stabilize BP. D. Assess digoxin level after the next dose. Answer. B. Hold digoxin and notify the healthcare provider. Rationale: bradycardia, nausea, and visual disturbances are signs of digoxin toxicity. Withholding the drug and alerting the provider for serum level testing prevents arrhythmias or cardiac arrest. Question 25. A patient on long-term warfarin therapy presents after a fall with a headache and an international normalized ratio of 6.4. What is the most critical priority action by the nurse? A. Reassure the patient and apply ice. B. Hold warfarin and notify the provider. C. Prepare for a stat-head CT and assess neurostatus. D. Administer vitamin K and monitor international normalized ratio in 4 hours. Answer. C. Prepare for a stat-head CT and assess neurostatus. Rationale: an international normalized ratio, 6, with a head injury increases risk of intracranial hemorrhage. CT imaging is needed immediately before any reversal or decision about therapy changes. Question 26. A patient on IV amphotericin B suddenly develops a temperature of 39.5 degrees Celsius, severe rigors, and hypotension. What is the priority nursing action? A. Premedicate with antipyretics for the next dose. B. Continue infusion and reassess in 30 minutes. C. Stop the infusion and notify the healthcare provider. D. Administer acetaminophen and monitor temperature. Answer. C. Stop the infusion and notify the healthcare provider. Rationale: these signs may indicate a severe infusion reaction or impending anaphylaxis. The nurse must act fast to stop the drug and alert the provider. Continuation or delay can lead to cardiovascular collapse. Question 27. A patient taking hydralazine for hypertension develops joint pain, fatigue, and a malar rash. ANA is positive. What is the nurse's next best action? A. Document findings and educate about lupus symptoms. B. Continue hydralazine and refer to rheumatology. C. Report symptoms and prepare to discontinue the medication. D. Schedule a dermatology consult for the rash. Answer. C. Report symptoms and prepare to discontinue the medication. Rationale: these are hallmark signs of drug-induced lupus, a known complication of hydralazine. Drug discontinuation is essential to reverse symptoms and prevent progression. Question 28. A patient on rifampin for active tuberculosis reports dark urine, persistent fatigue, and scleral icterus. Which intervention takes clinical precedence? A. Continue therapy and increase fluid intake. B. Notify the provider and check liver function tests. C. Reassure that discoloration is expected. D. Delay the next dose and monitor bilirubin weekly. Answer. B. Notify the provider and check liver function tests. Rationale: rifampin-induced hepatotoxicity is suspected here. Jaundice and dark urine are red flags requiring immediate LFT evaluation. Continuing without labs risks liver failure. Question 29. A child on long-term methylphenidate therapy for ADHD is noted to have significant weight loss, aggressive behavior, and difficulty sleeping. What is the highest priority nursing action? A. Educate caregivers about expected stimulant effects. B. Recommend bedtime dosing to reduce side effects. C. Notify provider to assess for dose adjustment or alternative therapy. D. Suggest increasing dietary intake and activity. Answer. C. Notify provider to assess for dose adjustment or alternative therapy. Rationale: these symptoms indicate potential toxicity or poor tolerance. Provider involvement is crucial to prevent growth delay and behavioral deterioration. Question 30. A patient receiving haloperidol becomes diaphoretic, confused, and rigid with a temp of 40 degrees Celsius. Blood pressure is 160/104 mm of mercury. What is the nurse's first response? A. Recheck vital signs and reassess in 30 minutes. B. Continue haloperidol, but monitor for worsening symptoms. C. Discontinue haloperidol immediately and initiate rapid response. D. Apply cooling blanket and administer acetaminophen. Answer. C. Discontinue haloperidol immediately and initiate rapid response. Rationale. This is classic neuroleptic malignant syndrome, a medical emergency. The antipsychotic must be stopped and ICU-level supportive care started without delay. Question 31. A patient receiving methotrexate for severe psoriasis presents with bleeding gums, petechiae, and reports a new onset, severe headache. Which action must the nurse take first? A. Reassess the dosage schedule. B. Assess platelet count and perform neurochecks. C. Apply oral care protocol for mucositis. D. Administer prescribed leucovorin rescue therapy. Answer. B. Assess platelet count and perform neurochecks. Rationale. These symptoms suggest thrombocytopenia with possible intracranial hemorrhage. Neurodeterioration can be rapid. Platelet count and neurostatus must be checked before further actions, including rescue therapy. Question 32. A teenager on isotretinoin reports worsening depression and vague statements about not wanting to be here anymore. The patient lives alone. What is the nurse's immediate legal and clinical responsibility? A. Schedule outpatient psychiatric counseling. B. Document and notify the pharmacy. C. Activate emergency mental health protocol and ensure patient safety. D. Ask the patient to contact their guardian. Answer. C. Activate emergency mental health protocol and ensure patient safety. Rationale. Vague suicidal ideation with social isolation indicates imminent risk. The nurse must activate emergency psychiatric response, notify the provider, and initiate suicide precautions immediately. Question 33. A patient with chronic psoriasis on systemic corticosteroids presents with acute dyspnea, chest pain, and unilateral leg swelling. What is the nurse's first critical assessment? A. Check for signs of infection. B. Perform bilateral calf measurements. C. Assess oxygen saturation and initiate rapid response. D. Notify the provider and request chest X-ray. Answer. C. Assess oxygen saturation and initiate rapid response. Rationale. Symptoms point toward pulmonary embolism, a life-threatening emergency. Airway, breathing, circulation, ABCs dictate that O2 status and rapid team activation are first priorities. Question 34. A patient on long-term cyclosporin for psoriasis has a blood pressure of 182/118 mm of mercury and a creatinine of 2.8 milligrams per deciliter. Which interdisciplinary intervention should the nurse anticipate immediately? A. Consult nephrology and withhold next cyclosporin dose. B. Administer antihypertensive and monitor BP hourly. C. Notify pharmacy to substitute with methotrexate. D. Encourage fluid intake and schedule urinalysis. Answer. A. Consult nephrology and withhold next cyclosporin dose. Rationale: nephrotoxicity and hypertensive crisis are serious cyclosporin adverse effects. Immediate hold of drug and nephrology consult are needed to prevent renal failure or stroke. Question 35. A patient with generalized plaque psoriasis has been applying clobetasol over 20% of their body surface for months and now presents with muscle weakness, fatigue, and moon face. What is the nurse's highest priority action? A. Notify provider of suspected Cushing's syndrome. B. Reduce corticosteroid application and monitor weight. C. Obtain liver function test results. D. Recommend switching to a lower potency steroid. Answer: A. Notify provider of suspected Cushing syndrome. Rationale: chronic high-potency steroid use over large areas can result in systemic absorption, leading to iatrogenic Cushing syndrome. This is an endocrine emergency requiring immediate provider intervention. Question 36. A patient on etanercept for psoriasis complains of a persistent cough, night sweats, and weight loss. The chest X-ray shows cavitary lesions. What is the nurse's immediate action? A. Place the patient on airborne precautions and notify the provider. B. Continue treatment and schedule TB test. C. Encourage hydration and reassess in 72 hours. D. Initiate broad-spectrum antibiotics per standing orders. Answer: A. Place the patient on airborne precautions and notify the provider. Rationale: these are signs of active tuberculosis, a known risk with TNF-alpha inhibitors like etanercept. Immediate airborne isolation and provider notification prevent transmission and ensure appropriate treatment. Question 37. A woman of reproductive age on acitretin expresses desire to conceive. She stopped the medication 5 months ago. What must the nurse do before giving clearance for conception? A. Educate that conception is now safe. B. Verify 2 negative pregnancy tests 1 month apart and consult obstetrics and gynecology. C. Request serum acitretin level and liver enzymes. D. Reinforce waiting a full 3-year contraception period. Answer: D. Reinforce waiting a full 3-year contraception period. Rationale: acitretin is highly teratogenic and can remain in fat tissue for years. Pregnancy must be avoided for at least 3 years post-discontinuation, even if blood levels are low. Question 38. A patient with pustular psoriasis treated with infliximab develops severe abdominal pain, fever, and bloody stools. What should the nurse anticipate preparing for? A. Colonoscopy to assess for perforation or toxic megacolon. B. Fluid bolus and antidiarrheal therapy. C. Diet change to low residue meals. D. Discontinue treatment and start oral prednisone. Answer: A. Colonoscopy to assess for perforation or toxic megacolon. Rationale: infliximab increases the risk of serious GI complications such as colitis and toxic megacolon. Colonoscopy and imaging help determine severity and need for surgical intervention. Question 39. A patient abruptly stops systemic corticosteroids used for erythrodermic psoriasis and presents with hypotension, confusion, and hyponatremia. What is the nurse's most time-sensitive action? A. Administer IV corticosteroids and isotonic fluid stat. B. Elevate legs and administer oral fluids. C. Notify the provider and request psychiatry consult. D. Wait for morning cortisol labs before intervention. Answer: A. Administer IV corticosteroids and isotonic fluid stat. Rationale: the symptoms indicate acute adrenal insufficiency, a life-threatening emergency. Treatment with hydrocortisone 4 and fluid resuscitation is essential to prevent shock and death. Question 40. A patient using high-dose topical salicylic acid over large areas presents with tinnitus, hyperventilation, and confusion. Labs show metabolic acidosis. What is the nurse's first action? A. Discontinue salicylic acid and notify the provider. B. Administer sodium bicarbonate 4 as ordered. C. Prepare for dialysis and intubation. D. Reassess symptoms in 30 minutes. Answer: A. Discontinue salicylic acid and notify the provider. Rationale: the patient has signs of salicylate toxicity, which can rapidly progress to coma or death. Immediate discontinuation of the agent and provider notification are essential for further toxicology management. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.